Well, he could maybe get a tax-free over in the UK. I don't have to check in with him on that. Thank you, Rich. Well done, as always, getting through all this stuff. 1 a.m. vote this morning. Crazy times in Washington. Let's get an instant audit on all these healthcare stories as we bring back Tim Call from Capital Management. And Yuri Mann is with us, financial analyst this morning as well. Yuri, what do you make of what's happening in D.C.? It looks like we'll get this thing passed before Christmas. You in favor or against?
Well, I think it's a done deal. I think we're going to have this piece of legislation passed. I'm certainly against the piece of legislation. It's going to be a huge cost to the American taxpayer, $870 billion. That's just an estimate, and I think it'll go higher from there. It also doesn't really accomplish what we wanted it to do, which is to give universal health care. There's still 20 million Americans who will not be covered by this piece of legislation.
Well, many of them are illegals.
It looks like the compromises went... Yeah, well, some of them are illegal. Some of them are just American citizens on the fringe of society. Right. And it's unfortunate that it just doesn't cover and go far enough. All
right, let me go through the numbers here, Tim, from what the the Congressional Budget Office put out. It was, as Yuri says, $871 billion. But it will reduce the deficit, they say, because taxes are going up and fees are added by $132 billion over 10 years. In terms of the share of people insured, right now it's 83% of non-elderly people with insurance. That'll go up to 94%. So something's getting done. Maybe it's not what everybody expected, but there's movement to have more people insured. Tim, is it worth the cost we're paying?
Well, it's contrary to the direction that Washington's trying to go into right now, which is job growth and economic rebound. What they're doing is raising taxes immediately in order to fund the added insurance benefits just in 4 or 5 years from now. So the added taxes and, as you put it, the fees right now, that raises prices, it lowers economic growth and lowers employment growth. Right. So it's odd that the same Congress is talking about stimulus as is passing this health care proposal, which immediately taxes and then provides health care benefits several years from now.
All right, so that's the deal. 60-40 passage there. We look to Thursday evening, I should say, and possible passage of the entire bill. All right, Yuri and Tim, while I have both of you guys still here, right before we talked about the politics of health care in Washington, we have the business of health care playing out this morning with a couple of acquisitions, the biggest of which is Sanofi Aventis, the overseas company, buying Chatham. Tim, you first. What do you make of that deal?
It's a good deal if they want to become more like Johnson & Johnson and have a consumer products arm. What they're buying are a lot of non-prescription products, over-the-counter products. And so this will stabilize their revenue and their earnings in a time of uncertainty for pharmaceuticals in case pharmaceutical taxes go up, in case the volume growth for pharmaceuticals does not rise for several years until these added people get health care. So it takes away some of the uncertainty, adds stability. It does take away some of the growth opportunities as well, because you're buying a bunch of slower growth products that have been around for a long time. There are not many new technologies that they're buying in this portfolio. So if you're a growth investor, you don't like this. If you're more of a stable, long-term value investor, this might be attractive.
Where do you fit in, Yuri? Do you like the deal or not?
I agree with Tim. I think the negative here is that the pharmaceutical companies that have been lagging in terms of stock prices over the last quarter that are going to see a bounce now as more clarity comes out of this legislation and people really understand the 2,000 pages. Those pharmaceutical companies that we're going to be benefiting, this company is now a diversified company with consumer products, so it may not have the same sort of bounce in stock price. So if you're looking at it as an investor in the short term, you might think of this as, it may have some sort of a negative effect on the stock price in terms of not seeing as much upside. But it definitely does diversify their portfolio of products and put them, as Tim mentioned, into the J&J model of being able to provide retail consumer products that are not necessarily taxed under the new legislation.
All right, but we'll look for Chatham to be a big gainer in today's stock market for whatever that is worth, $2 billion deal or thereabouts. Tim and Yuri, thanks a lot. I want to know what all you guys think about this.